Hi, good day to all. I'm Dr. Dinesh Kumar, third year MD General Surgery from HUSM, and I would like to present an interesting case on a spontaneous retroperitoneal hemorrhage secondary to an anticoagulant therapy in COVID-19 patient with pulmonary embolism. It's a case report. I would like to thank Mr. Mokhzani, Mr. Neil Amre, and also my friend Dr. Premanraj for all the guidance. Introduction. Spontaneous retroperitoneal hemorrhage, also known as Wunderlich syndrome, is a sudden onset of bleeding into the retroperitoneal space without any associated trauma or iatrogenic manipulation. The etiology remains unclear. With advent of COVID-19, which is a pandemic now, it is associated with hypercoagulable state, resulting in acute thrombotic event requiring anticoagulant therapy. So we would like to present a interesting case on a 69-year-old lady with an underlying multiple comorbidities presenting to our department with a 1 week history of fever and also chest cough. She was diagnosed with a category 4 COVID-19 and was admitted to ICU. On day 3 illness, her condition deteriorated, requiring intubation, and also a CTPA was done, which showed a pulmonary embolism of the right descending pulmonary artery. She was started on a low molecular weight heparin, and on day 2 post-therapy, she had an unexplained drastic drop in hemoglobin. A mass was later noted over the suprapubic region, and a CT abdomen pelvis showed a huge hematoma with no active contrast flush. The anticoagulant was immediately withheld, and she was transferred with blood products with a plan of emergency drainage and hemostasis if condition deteriorate. After 48 hours, her condition improved and the hemoglobin stabilized, and CT abdomen on a day 5 noted reduction in the size of hematoma, and subsequently her condition regained well and she was able to be discharged well. So this was her CT scan showing a huge retroperitoneal hematoma without any iatrogenic intervention. So this kind of patient with COVID-19 has high tendency to develop any acute thrombotic events. Anticoagulant therapy play a vital role in venous thromboembolism. Wunderlich syndrome is also known as a spontaneous retroperitoneal hemorrhage, was first described in 1700. The most common symptoms are abdominal pain and unexplained drop in hemoglobin. Etiologies remain unclear and diagnosis is via the CT scan. Treatment usually it spontaneously resolves. On if at all it fails, intervention in forms of minimally invasive procedures, radioembolization, as well as open drainage can be executed. So to conclude, heparin and anticoagulants may cause severe hemorrhagic complications in COVID-19 patient. So therapeutic doses in these kind of patients should be administered very carefully, and these patients should be monitored very closely. In cases where there is an unexplained drop in hemoglobin, SRH has to be considered as one of the provisional diagnoses. Thank you.